Schneider from the Cancer Society, American Cancer Society Cancer Action Network.
Good morning. My name is Hilary Schneider. I am the Maine Government Relations Director for the American Cancer Society Cancer Action Network. Cancer impacts everyone, but it does not impact everyone equally. In Maine and across the country, tobacco use is the leading preventable risk factor for cancer and one of the leading causes of cancer disparities. In Maine, more than 1 in 5 cancer cases and nearly 1 in 3 cancer deaths are related to smoking. Nationally, Maine has the 6th highest rate of tobacco-related cancer cases and the 11th highest rate of smoking-related cancer deaths. All individuals should have an equal opportunity to live a healthy life. But when it comes to tobacco-related death and disease, that's not the case. Tobacco use is as much a racial and social justice issue as it is a public health concern. The tobacco industry weaponizes flavored products to target youth, LGBTQ individuals, and communities of color. These populations now bear an undue burden of death and disease caused by tobacco use. Although tobacco-related cancer incidence or mortality have declined in the US, we continue to see higher rates of tobacco use and tobacco-related cancer incidence and mortality among individuals with lower incomes and lower educational attainment, as well as among individuals who are Black, Native American, LGBTQ, or who have been diagnosed with a mental or behavioral health condition. Our ability to continue to make progress against cancer relies heavily on eliminating the inequities that exist in cancer prevention and care, including passing strong policies that reduce and prevent tobacco use. As you have heard today, the tobacco industry has spent decades and billions of dollars aggressively marketing menthol and other flavored tobacco products to intentionally hook and addict targeted communities. Menthol in cigarettes increases smoking initiation, undercuts attempts to quit, and leads to greater addiction than non-menthol cigarettes. The tobacco companies are well aware of the addictive nature of these products and deliberately use them to hook new users of their deadly products. And big tobacco strategy has worked. Black people consistently report the highest prevalence of menthol cigarette use. More than half of youth aged 12 to 17 who smoke use menthol cigarettes compared to 1/3 of adult smokers. Among 18 to 25-year-olds who smoke, 59% who identify as lesbian or gay report using menthol cigarettes compared to 46% of those who smoke and identify as heterosexual. These health disparities are the very real result of both the relentless tactics of the industry and the lack of comprehensive action by federal, state, and local policymakers. In Maine, nearly 1 in 5 adults smoke cigarettes, the highest rate in the Northeast. Only 2 Maine counties, Cumberland and Saginaw, have adult smoking rates at or below the national average. More than 1 in 15 Maine high school students smoke cigarettes, with a high of 1 in 8 in Washington County. In recent years, overall youth tobacco use in Maine has skyrocketed, largely driven by the youth e-cigarette epidemic. 1 in 2 Maine high school students and 1 in 6 middle school students have used e-cigarettes. Nearly 30% of high school students are current users of e-cigarettes, nearly doubling from 15% in 2017. In Piscataquis County, high school e-cigarette use quadrupled, and it nearly tripled in Oxford County during the same 2-year period. The use of flavored tobacco products by youth and young adults is also high. 95% of adult smokers started before the age of 21, and 4 out of 5 kids who have ever used a tobacco product started with a flavored product. Tobacco companies have developed an array of menthol, mint, and candy flavored products. In fact, there are more than 15,000 e-cigarette flavors, up from just 8,000 in 2014. Products with flavors like cherry, grape, cotton candy, and gummy bear are clearly not aimed at adult smokers. Years of tobacco industry documents confirm the intended use of flavors to target youth, and it's working. Youth report flavors as a leading reason why they use tobacco products and perceive flavored products as less harmful. Put simply, flavors hook kids. Public policy change can and must serve as a central avenue for shielding against and reversing long-standing inequalities, but only when done comprehensively and with the well-being of people of color, people who are low income, and LGBTQ populations in mind. We must also ensure that policies do not perpetuate historical inequalities and play into the hands of who benefit from them. Passing policies like ending the sale of menthol cigarettes and all other flavored tobacco products will not only reduce tobacco use and thereby tobacco-related cancers, but it will also reduce health disparities. We must stand up to big tobacco's attempts to use loopholes and exemptions to weaken policy proposals. If we do not ensure the policy solutions include all tobacco products and all flavors, then the policy will directly fail to protect children in predominantly Black and LGBTQ communities, who we know are being targeted with these dangerous products. Leaving flavored tobacco products on the market prevents us from being one step closer to achieving health equity. We call on the Maine legislature to act now to end the sale of all flavored tobacco products. Thank you.
Thank you very much, Hilary.